you can get insurance and then how much it covers.
That's exactly
for
right.
even natural situations.
Exactly, exactly.
So women probably are more likely to have more health care debt than men.
We believe they do. We know that women are more likely to face medical bill problems than men. They're more likely to have charged up credit card bills or received notice about late bills because of their problems paying for medical debt. But overall, women are more likely to experience medical bill problems than men.
Well, it's really difficult to accept that reality, and hopefully we can change it.
Absolutely.
Now, I understand that you're launching some new initiatives at your organization. Could you tell me about that?
Yes. Today we just launched a new effort to try to bring more women into the debate around healthcare reform in what we hope will be the final push to get it done. Again, the image that we had from this summer from the town halls around health reform were that of angry men waving their fists in the air. And we said to ourselves, where are the women? Because we know that women need health reform and are demanding it for their families. So we've launched a new public awareness campaign today called Being a Woman is Not a Pre-Existing Condition. And the name of our campaign speaks to the many challenges that women face. It speaks to the issue of survivors of domestic violence, that in 8 states in the District of Columbia it is still legal for insurance companies to reject survivors based on their status as a DV survivor. For the fact that women find it so hard to get maternity coverage in the individual market, that the rape survivor who spoke at our press conference today about how she wasn't able to find health insurance because she had received medical treatment after her rape. So all women joining together to raise their voices. We've launched a new video that speaks to this kind of discrimination that women face. And Congresswoman, I'd love to present you with a T-shirt from our campaign, A Woman is Not a Pre-Existing Condition. And then our website is on the back where folks can go. It's awomanisnotapreexistingcondition.com, where folks can learn more about the challenges that women face in our current healthcare system. And they can send a note to their member of Congress to encourage them to pass health reform now that works for women and their families, and learn more about the challenges that women face in our current healthcare system through a new video that we've launched. So I would encourage your viewers to take a look at our new website.
Well, thank you very much, and I appreciate what you're doing to help to get the information out so people will know. I know there are many, many women out there that know what the problems are, but they're so busy trying to keep things going and keep from going under that they don't take part often.
That's exactly right.
In this type of activity. But it's really needed. And I have heard so many stories since I have focused on healthcare coverage and the reform that we needed, that it's a lot worse than what I thought.
Mm-hmm.
And people are suffering a great deal more than what the average person knows about. Working women especially have a very difficult time. And I thought if they were young and healthy, it would be easy. But if they're young and healthy, I guess they're also childbearing age, and so they still get a whammy.
Mm-hmm.
It's so unfortunate, and our country does not deserve this. So I'm hoping that everyone come to think about how difficult it is for people, and most especially women, to have health care coverage, and how we just don't deserve it. We're paying for it, we're just not getting it. The cost that we pay for health care coverage is really enough to pay for real coverage, but we're not getting it.
Exactly. And when you think just about the issue of excluding maternity, I mean, this is a basic health care need for women. We would be hard-pressed to think of any other health insurance policy that excludes from coverage a basic health care service that only men need. Mm-hmm. I would challenge any insurance person to show me a specific basic health care need that only men need that is excluded from health insurance policies that are sold in this country.
Yes, and you know, the other thing is I get lots of mail saying don't cover abortions. Well, it really says to me that you really don't know the situation that women are facing with health care insurance. I know there's a lot of religious beliefs against abortion, but also, to me, it's something that only that person and her physician or family can make that decision. But if they can't get coverage, it could really work on whether or not we are keeping our planet populated well, because if women cannot get coverage, they probably will just stop trying to be pregnant, and which is very, very unfortunate. And there should be no system that is that difficult for a woman to deal with, and most especially health insurance. You know, they keep saying we're one of the richest countries. We have put out more for research and finding breakthroughs, but it's the most costly country in the world for health insurance. And in addition to that, the gender rating makes it even worse.
Absolutely.
It's almost embarrassing to talk about that this is what America is about. And it's all because of greed, because of the cost, because of not wanting to pay out for what people pay for.
Mm-hmm.
Insurance is paid into a system in case you need it. And quite a few people don't, but there are some who do. And when they do need it, they should be able to get it.
That's exactly right.
So let me say to our general public here today that we must push for health insurance reform. That's really where the reform needs to be. That is really where people are getting mistreated, actually, because they're paying for a lot more than what they'll ever get. And as soon as they cost the insurance companies anything, they're subject to lose that coverage. Can you just imagine a mother being willing to give her son a kidney and then realizing that her insurance is going to cancel her coverage because of it? This has gone too far, and it is time for that change to come. And we must all be a part of making that change come. Write to us, write to your congresspeople, speak out, talk about it in your clubs, talk about it when you go to shop, talk about it when you go to church. Let the world know that we are not going to sit idly by and be used by insurance companies in the way that we're experiencing now. Every day I hear about something that's even worse. The change must come. It is needed, and we need it now. And you must be a part of informing the public so that we can get this done. It's only so many insurance companies that provide health coverage, and they're not even subject to antitrust. So they can make up their prices, they can make up their rules, and they can share them, so going to another company does not even help. That must be corrected as well. I pay lots of insurance. I'm not angry toward insurance companies, but I'm very disgusted that they do not hold up what they promise to hold up, and they are not what they should be for the American people. So let's change it. It needs change, and it needs that change now, and we must be a part of making that change come about. If nobody else pushes, women should, because it's gender rating that costs us a lot more than males to have insurance. Thank you for watching. I'll see you next week. Thank you very much for coming.
Thank you, Congresswoman.
And I appreciate what you're doing, and I know that every woman appreciates that as well.
We appreciate your efforts as well. Thank you.
Thank you, and see you next week.
This has been another edition of Report from Washington featuring Congresswoman Eddie Bernice Johnson. You can reach Congresswoman Johnson at 202-225-8885 or 214-922-8885. You can also contact her through her website at http://www.house.gov/ebjohnson.